Who should not be using semaglutide, tirzepatide, our favorite GLP-1 medications? Let's talk about it. If you're new to my channel, hi, I'm Dr. Jones, DC, a holistic obesity expert that specializes in sustainable weight loss. I work with medical practitioners. We utilize peptides medications to help our patients ultimately wean off the medications while securing lifelong weight maintenance. This is something that I certainly cannot tell you the answer to. You need to be working, hopefully, with some sort of physician or have some sort of support with somebody who is looking at the medical history and can help guide you in this situation. What I can share with you, though, are some medical contraindications. Out of concern for your health, please don't go purchase these online, because unfortunately people can, if you have any of these issues. To me, that's the scariest thing out there, because you can literally purchase these things online nowadays. Please be informed and educated and understand these following medical issues that can be problematic if you start GLP-1 medications. Number one, pancreatitis. So pancreatitis is inflammation of the pancreas, which out of all the different itises and of the different organs that can get inflamed, acute pancreatitis is pretty lethal. It can kill you. It can really hurt you and put you in the hospital very fast. And so it's definitely a inflamed organ situation that you don't want to take lightly. And one of the ways that you can find out if you might have angry and unhappy pancreas is by getting pancreatic enzymes drawn on lab. And it's crazy to me that a lot of clinics don't do that for their clinics. That's like we won't even prescribe somebody without looking at their pancreatic enzymes. Doesn't mean you have pancreatitis, but it means you may. And if you see high enzymes, you need to be working with a practitioner anyways to get to the root cause of that and make sure it's not something that's trending towards a horrible situation. Number two, family history of thyroid cancers. There was actually some literature that came out. I did a video on this that talked about how the likelihood that these medications are actually perpetuating or causing thyroid cancers in humans is probably not something that we need to worry about compared to what we thought originally. But the verdict is still not out. It did cause some specific rarer types of medullary carcinomas in rodents. And because of that, it's too big of a risk to ignore. And you definitely should not be trying to get on this medication if you have any sort of family history of thyroid cancer. It's not freaking worth it. Be safe out there. Number three, you are on diabetic lowering medications. This medication is it's a diabetes medication. Mounjaro and Ozempic treat diabetes. It freaking lowers blood sugar. And so if you're on other diabetic lowering medications, especially if you're on insulin, then you need to be very careful. Yes, medical practitioners that are managing your diabetes are doing this all the time, but they're medical practitioners with a ton of clinical experience, and even they could mess up sometimes when trying to find the perfect balance between your insulin and your diabetic medications and this medication. It's not worth it, guys. Do not try to do that on your own. The problems that can arise are too serious. Stay safe out there. I hope this informed you guys. Trust me when I say staying obese, and I have a ton of videos about this, is also very problematic. And so if you are stuck in those situations, not all is lost. In fact, I have this really awesome medication that I'm a big fan of. It's called tesofensine, and it works freaking almost as well as semaglutide or tirzepatide. If you want some help there, get some guidance, click my profile icon, scroll to the top, schedule yourself a free consultation, and let's kind of get into the weeds of this so that we can help you make the best decision. And again, stay safe out there, guys.